My son was a patient in Helen DeVos Children's Hospital Pediatric Critical Care Unit. I was sitting where you are now. It's human nature to worry when your child is in the hospital, even more so when he or she is in the PICU, as it's commonly referred to here at Helen DeVos Children's Hospital. For most of us, the hospital is a very unfamiliar place. For the next few minutes, PICU employees will provide you with helpful information about the unit and the services it offers. We hope this makes you feel more prepared to help your child on his or her journey to wellness. Because of the exceptional care my son received here, he is a healthy and thriving young adult today.
The critical care unit is for infants, children, and teens who need intensive care or monitoring. To enter this unit, you need an identification badge issued by security staff at the welcome area in the Children's Hospital lobby. The unit secretary will let visitors onto the unit with the appropriate ID badge. Your child's nurse will provide you with a confidentiality code, also referred to as a personal identification number or PIN. This code is assigned specifically to your child. Using your child's PIN, you can call the hospital from an outside phone to receive information about your child. Give this code number only to people you trust to know and receive medical information about your child. We recognize that during this stressful time, it is important for you to stay connected with your friends and family members. For your convenience, all incoming phone calls to the hospital go through the secretary. The secretary will transfer your calls to the phone in your child's room. If you are unavailable, the secretary will take a message. Cell phone use is permitted in your child's room. However, to maintain a quiet and healing environment, we ask that you set your phone to vibrate or silent mode and keep calls brief or take them in the family lounge.
As we care for your child, we are dedicated to providing a safe environment. Please help us maintain your child's safety by becoming familiar with the unit and its guidelines. Parents and guardians are not considered visitors. They are valued members in the healthcare team. You are welcome to visit at any time, and accommodations are available for 2 parents or guardians to stay overnight. Normally, 3 people, other than hospital personnel, are allowed in the patient's room at one time, including parents. We try to accommodate your individual needs, but your child's safety is our primary concern. A nurse may ask visitors to step out of your child's room if necessary. The most important way to prevent the spread of infection is through hand hygiene. Always wash your hands and use hand sanitizer when you enter and exit your child's room. If your child is in isolation, be prepared to put on a gown, mask, or gloves. This is not only for your protection, but also for the other patients and families in the Pediatric Critical Care Unit and the hospital.
In the PICU, we monitor vital signs, such as heart rate, blood pressure, and oxygen level. You may see many wires connected to your child. These are used to measure different functions. Your child's medical team has access to this information on the monitor in your child's room as well as throughout the unit. A member of the medical team is constantly monitoring your child's vital signs. If your child needs assistance and you do not see your nurse, press the nurse call button.
You are an important member of your child's healthcare team, and we really do value your input. Daily rounds are an opportunity for you to interact with the rest of the healthcare team. Daily rounds is the time when the entire healthcare team gets together to discuss your child's care plans for the day. This team includes doctors, nurses, pharmacists, nutritionists, social workers, respiratory therapists, and you. This is an opportunity for you to ask questions or voice concerns to any member of the team.
Thank you for viewing this introduction to the Helen DeVos Children's Hospital Pediatric Critical Care Unit. If you have questions or require additional information, please ask any employee and he or she will help you. We want your experience to be exceptional, and we look forward to partnering with you to provide the best care for your child. Thank you for choosing Helen DeVos Children's Hospital.